This is Dr. Aayesha Banu. I completed my post-graduation from Deccan Medical College of Medical Sciences. Presently, I'm working as consultant at Honest Derma Skin Clinic, Hyderabad. So today, my topic is what is eczema, what are the causes, and how we gonna treat the eczema. So what is eczema? Eczema is an inflammatory skin condition causing itchiness, dry skin, rashes, scaly patches, blisters, and skin infection. The symptoms seen in every individual basically are 4: itch, dryness, roughness, and oozing associated with crusting. Eczema rash look like, it varies in individuals with light color. In light color individuals, it is seen as red, dry, patchy skin, and with oozing and crusting. And individuals with dark skin tone may experience eczema as darker brown skin lesions. Prevalence of eczema among Indians. So how common is it present in India, eczema? So in children's between age of 6 to 7 years, it is seen as 2.5% of the normal individuals. And in adult, it's about 10% of the normal population. And in children's between 13 to 14 years, it accumulates almost 3.5%. So what are the causes of eczema? Eczema basically happens because of 3 main disturbances, such as first one is due to overactivity of immune system. Eczema patients, they have an overactive immune system. The immune system considers small irritants or allergens in the environment as an enemy and in turn causes inflammation. The inflammation further causes symptoms of eczema. And the second is genes of patients. Eczema is more common in individuals with a family history of eczema or dermatitis. Such individuals may have an altered gene which does not allow the skin barrier to function normally. In this patient, basically, there is a mutation in filaggrin protein. Actually, filaggrin protein is normally found in all the individuals, but in eczema patients, the filaggrin protein mutation is present. Actually, filaggrin protein, it maintains the skin barrier, healthy protective skin barrier, and it stop the skin from imbalances resulting such as due to like protease activity will increase in such patient, leading to total loss of water from the skin. And third cause is environment. Multiple things present in the environment can predispose to eczema, such as smoke, air, pollutants, harsh soap, fabrics such as woolen, and some skincare products. Low humidity, dry air also makes skin dry and itchy. Fourth is emotional triggers, such as high level of stress, anxiety, or depression can flare up the eczema. So which are the body parts which are commonly affected by eczema? So the common parts are hands, neck, elbow, ankle, knees, feet, face, especially the cheeks, in and around the ears and lips. Does eczema cause pain? Yes. Usually it doesn't cause pain. However, scratching the eczema skin leads to soreness, which can be painful. Some type of eczema, like contact dermatitis, can cause burning sensation and discomfort. So what are the triggers? Basically, the triggers are dry weather, smoke and pollutants, clothing material, skin product or makeup, and stress. Is eczema contagious? No, definitely it's not contagious. It's just an allergic reaction. Can eczema be cured? There isn't cure because it is due to the change in the immune system and environmental triggers. And due to this skin barrier changes, and because of, if patient is like, if parents are having already eczema, then patient is prone to eczema compared to the normal individuals. So how do we manage and treat the eczema? The first step is moisturize. Always we need to ask patient to moisturize the skin immediately after taking bath, and patient should take always lukewarm water bath. That is only warm water bath, never hot showers. And immediately after dapping the skin, when the skin is still moist, the patient should apply moisturizer judiciously, because it makes the skin more moist, preventing it from becoming dry. And topical and oral medicines are recommended, such as topical steroids, topical calcineurin inhibitors. These topical and oral medications, such as steroids, oral corticosteroid and oral anti-inflammatory medicines, oral antihistamines are prescribed to reduce the itchiness and swelling. Patient who doesn't get much result with topical and oral medications are given immunosuppressants and injectable biologic to regulate the immune system, because the main defect is in the immune system, that is filaggrin protein mutation. Other treatment which are available are to improve the skin and reduce the blemishes caused due to eczema. Light therapy is a good treatment mode of treatment. And we should ask patient to always prevent flare-up, that is avoid triggers. We should advise patient to use moisturizers such as which are hypoallergic, fragrance-free, and gentle, which do not have preservatives or stabilizers, and it should contain lipids and ceramides. Other moisturizers which can be prescribed are petroleum jelly, mineral oil. Properties of an ideal moisturizer should be hypoallergic, fragrance, dye-free. So these are the properties which we should see in a moisturizer when we are prescribing as a healthcare provider to a patient. What are the complications of eczema? The possible complications are weeping eczema. In weeping eczema, the skin forms fluid-filled blisters. And the second one is infected eczema, where because of eczema, the skin barrier gets disrupted, because of which the bacteria, fungus, and virus, they can easily enter our body. Because the skin barrier gets disrupted, so the capacity of skin to maintain a barrier to resist Staphylococcus aureus to enter our body is disrupted, because of which easily the Staphylococcus aureus can accumulate on our skin. So what are the symptoms that indicate complication? The patient will present with fever and chills, a clear yellow fluid leaking out of the blisters on the skin, pain and swelling. So what are the ways to prevent eczema? First, we should ask patient to apply moisturizer judiciously. They can apply moisturizer twice, thrice, regularly, and whenever the skin is damp, because it will act as occlusive as well as humectant. And we should ask patient to take always lukewarm water bath, never hot water. And drink at least 8 glasses of water daily. Avoid tight-fitting clothes. Manage the stress and avoid allergy. So the conclusion is eczema is an inflammatory skin disease causing itchiness, dry skin, rashes, scaly patches, blisters, and skin infection. Overactive immune system, family history of eczema, allergen and emotional triggers can cause eczema. Ways to manage include, we should always ask patient to use moisturizer, topical and oral steroids, medication, as well as topical calcineurin inhibitors, immunosuppressive treatment, light therapy, and avoiding triggers. Thank you.